Welcome to It's Your Case, presented by vetcity.com. I am Manuel Pinilla, your radiologist on demand for today. Today's example is a 3-year-old female French Bulldog presenting with acute onset tachypnea and pyrexia following episodes of vomiting. Once you have reviewed the radiographs using your systematic approach, then you are ready to watch this video. I will highlight the most important findings on these thoracic radiographs, and the first thing that caught my attention is in the dorsoventral view. So let's take a closer look to this area here. In this part, we are supposed to have the left cranial lung lobe, which is supposed to be full of air, and therefore it should be an air opacity, for example, as we can see on the right side. However, its opacity is increased, and in fact it is similar to the heart, and therefore it is a soft tissue opacity. So one of the main features, we've got an area of lung that is got a soft tissue opacity. If you look carefully, this is not a homogeneous soft tissue opacity, and you will be able to see a gas opacity, tubular shaped, running cranially here. And if you look closer, you will see another one running laterally in that area. Those are the bronchi of the left cranial lung lobe, which, if you remember well, is divided into two portions, the cranial segment and the caudal segment. You are not supposed to see the bronchi this well, and the reason why we can see them is because they are surrounded by lung that does not contain air, but it's got a soft tissue opacity, and that is what we call an air bronchogram, which is the main second feature of this area. The last feature is, if you, for example, try to follow the cardiac silhouette, you will be able to follow it around. It's got a very sharp, defined margin. However, when we come here to this part, we no longer see the cardiac silhouette margin. And the reason for this is because the lung, which now is got a soft tissue opacity, is similar in appearance to the heart, and therefore that border disappears. You can also see other signs of this. For example, if you look on the right side, you can see the internal surface of the thoracic wall, and here we've lost that line too. A last area where you can see that feature is, for example, in the rest of the lung, you can see the pulmonary vasculature. However, here that is lost too, and that is what we call a positive silhouette sign. And these are some of the main features of what we call an alveolar pattern. So what we can see in this radiograph so far is an alveolar pattern affecting the left cranial lung lobe. If you look at the lateral views, particularly on the area superimposed on the heart, you will be able to see some of these features, particularly the air bronchogram. So if you follow, for example, this bronchus, you can follow it into its periphery. You can see how it is branching and tapering gradually, and you should not be able to see the bronchi in the periphery like this. Same thing here right over the cardiac silhouette. And these are all air bronchograms, which we can see because that lung is got a soft tissue opacity instead of an air opacity. I'm going to go back to the dorsoventral view, and let's see if you spotted anything else. Remember to be thorough and look at the entire lung fields. And if you look here, there is the impression that there is some kind of soft tissue rounded opacity, almost like a nodule. If you look very, very carefully, you will notice that it is very sharply defined, but not all around it. Only this area here, we can see the margin, and this area here, the margin is lost. Whenever you see something on a radiograph, remember you must have orthogonal views, and you must go and try to find it in the other views. Whether you see it or you don't, is going to allow you to determine what that is. So we're going to go back to the left lateral view, and let's see if we can find it. Now that structure was superimposed on the center, slightly caudal part of the of the heart. So roughly we have to look for it in between these two red lines. I look very carefully at the lungs, and I cannot see any nodular structures anywhere in this or the other lateral view. However, I can see the lesion. Did you spot it? Right, it's down here. Can you see it? Let's zoom on that. If you look very carefully, we can find some of the main features that we saw before. It's got a very sharply defined margin here, but not all around it. And considering its position, this cannot be in the lung. What this is, in fact, is one of the nipples. And the reason why we don't follow it all around is because that is the area where it's attached to the rest of the skin. This is a common pitfall with thoracic radiographs, so you should be very, very careful because it can be easily overdiagnosed as a lung nodule. So to conclude in this dog, we've got an alveolar pattern of the left cranial lung lobe, Based on the distribution and appearance, this is fairly typical for aspiration pneumonia, which also fits very well with the clinical history. Now, there is a little bit of discussion about the radiographic appearance of aspiration pneumonia in the full report, which is associated with this case, so go ahead and check that. Thanks for listening, and remember, it is your case, so please post your questions on the social media.